Look at which side you slept on last night. Right now, before you do anything else. Most people say the right side, or their stomach, and they say it the way you say a preference, the way you say you take your coffee. I see something entirely different. I see a heart spending 8 straight hours working against the mechanics of its own anatomy. I see a brain that ran its waste clearance system at a fraction of its capacity while you slept. And here is what nobody is telling you. In the majority of people over 50 who come to me reporting brain fog, word loss, nighttime chest heaviness, and mornings that feel worse than the nights, the organ they are blaming is completely fine. The problem began the moment they lay down. Your sleep position is not a comfort preference. After 50, it is a physiological decision with consequences your doctor is not measuring and your body is quietly absorbing every single night. If that is the first time you have heard that, subscribe to Dr. Candace right now. It takes 5 seconds. We are working toward 100,000 subscribers on this channel, and every person who subscribes makes it more likely that the next person who needs this information actually finds it. The healthcare system generates revenue from visits, procedures, and prescriptions, not from patients who solve their problems at home with correct information. What I am about to tell you, no one in a clinic waiting room is going to say. There is no billing code for what I am about to share with you. So stay with me. You wake up at 3 in the morning, and your right arm is numb. Not the temporary tingle of a limb that shifted, a deep, heavy numbness that takes a full minute of shaking to release. You roll over. You adjust. Your neck along the right side carries a dull pressure you have started to treat as just how mornings begin now. By 7, you are already tired in a way that has nothing to do with the hour. Not groggy, tired. The specific exhaustion of a night that gave you hours, but not rest. Your chest carries a low-grade tightness that you have noticed more this past year. Subtle enough to dismiss, persistent enough that you notice its absence on the rare morning it is not there. You have already tried the new pillow. You have tried the wedge cushion. You have tried the herbal sleep blend your neighbor swore by, and you felt nothing. You have tried going to bed earlier, cutting the late coffee, turning off the television an hour before sleep. Some of it helped slightly. None of it fixed the mornings. And by noon, you are on your second or third cup of coffee just to make it to the afternoon without your concentration falling apart completely. I see this in the eyes of hundreds of patients, and almost every one of them says the same thing. I just don't sleep like I used to. I figured it was age. Let me be direct with you. Blaming your age for this pattern of exhaustion and morning heaviness is a lie. It is a dangerous illusion, and it needs to be shattered right now. Most people over 50 believe that sleep position is personal and neutral, the way handedness is personal and neutral. They have slept on their right side or their stomach for 30 or 40 years. They have a pillow shaped by that habit. They have adjusted their mattress to accommodate it. They have read a headline somewhere that suggested back sleeping is best, tried it for 2 nights, found it uncomfortable or worsening of their snoring, and returned to their position with a sense of vindication. They went looking for a sleep solution in supplements and schedules. Some of them found partial relief and accepted partial as the new standard. They were doing all of it while the mechanism causing the problem ran undisturbed every single night. They were fighting the symptom, not the cause. Think of your body's nighttime restoration system like a municipal water treatment facility that only operates between midnight and 6 in the morning. The crew arrives, the system activates, and the filters begin to clear the day's accumulation. But if a valve is closed, the flow rate drops. The crew does what it can. It processes a fraction of what it was designed to process. And in the morning, the water comes out of the tap looking mostly fine. But over years, the accumulation that was never fully cleared begins to build. Your brain operates on exactly this principle, and your sleep position determines whether the valve is open or closed. Before we go further, I need to say something as a physician with over 20 years of clinical experience. There are symptoms that should send you straight to a doctor, not to a video. If you wake at night with chest pain that radiates into your left arm or jaw, call for emergency help immediately. If you experience sudden confusion upon waking, one-sided facial numbness, or vision disturbance, do not continue this video until you have spoken to a physician. If your partner has repeatedly witnessed you stopping breathing during sleep and gasping awake, that is obstructive sleep apnea, and it carries serious cardiovascular risk requiring professional evaluation. If none of those apply to you, you can breathe. You are going to be fine. but the quality of that life is worth protecting. What comes next is the part nobody in a waiting room is ever going to explain, because explaining it properly takes longer than a 12-minute appointment and does not result in a prescription being written. Here is what is happening in your body right now. Your heart is not centered in your chest the way most people picture it. It sits left of your sternum, angled, with its most powerful chamber, the left ventricle, which is the thick-walled pump responsible for driving oxygenated blood through your entire body, oriented toward your left side. This anatomical positioning is not incidental. It means that when you lie down, gravity acts on the heart differently depending on which way you face. When you sleep on your right side, the heart's own mass shifts away from its resting biomechanical axis. The left ventricle, already the hardest working chamber in the body, is now pumping from a subtly displaced position, the equivalent of asking a person to swing a hammer from an awkward angle for 8 hours straight. The pericardium, which is the dense fibrous sac that encloses and protects the heart, experiences low-grade mechanical tension across the tissue where it anchors to surrounding structures. Research published in the European Journal of Preventative Cardiology found that patients with existing left-sided cardiac conditions, including heart failure and ventricular arrhythmia, showed measurably worse hemodynamic parameters when sleeping on the right compared to the left. That is not coincidence. That is geometry interacting with physiology every single night. I want to be precise about this. The sustained rightward positioning also places the stomach against the underside of the liver, which sits in the upper right quadrant of the abdomen. And this pressure relationship increases intra-abdominal pressure in a way that loads the lower esophageal sphincter, which is the valve at the bottom of the esophagus that prevents stomach acid from traveling upward. After 50, the resting tone of this valve naturally decreases. Right-side sleeping pushes gastric contents toward this weakened valve all night. Left-side sleeping does the opposite entirely. The stomach's anatomical curve means that in the left-lateral position, gastric contents pool toward the fundus, which is the uppermost rounded portion of the stomach, sitting away from the valve entirely. This is why every gastroenterologist in active clinical practice recommends left-side sleeping for reflux patients. It is not preference, it is physics applied to a specific anatomical curve. That is not the most important mechanism, not even close. Here is the discovery that I believe belongs in every conversation about brain health after 50, and that almost no one is having with their patients. Your brain has a dedicated waste clearance system. It is called the glymphatic system, with a G, named because it functions like the body's lymphatic network, but operates exclusively inside the central nervous system, using cerebrospinal fluid, which is the clear, protective fluid that surrounds and cushions the brain and spinal cord, to flush metabolic waste products from brain tissue. This system was first characterized by Dr. Maiken Nedergaard and her team at the University of Rochester, and what they demonstrated changed the field entirely. During waking hours, the brain's supporting cells, called glial cells, maintain a relatively dense interstitial space that limits fluid movement. During deep sleep, these cells actually contract in size, opening the interstitial channels between neurons by as much as 60%. Cerebrospinal fluid then flows through these widened channels in coordinated pulses, carrying metabolic debris out of brain tissue toward the cervical lymphatic drainage pathways, which are the outflow channels in the neck that connect the brain's waste stream to the body's lymphatic system. Think of a city sponge being gently compressed by a hydraulic press in the middle of the night, with the force channeled in one specific direction. The compression is precise. The direction is everything. And the answer to that question of direction may genuinely shock you. The primary waste product this system exists to clear is amyloid beta, which is the protein fragment that, when it accumulates over years in the spaces between neurons, forms the dense plaques associated with Alzheimer's disease. This is not a fringe hypothesis. It has been confirmed through cerebrospinal fluid sampling, positron emission tomography imaging, and animal studies replicated across research institutions on multiple continents. A study published in the Journal of Neuroscience directly measured glymphatic clearance efficiency across multiple sleep positions in living subjects and found a clear, statistically significant result. The left lateral position produced the most efficient clearance of amyloid beta and other metabolic waste. The right lateral position produced measurably lower clearance. And the prone position, meaning sleeping face down on the stomach, produced the worst clearance of all positions tested. The anatomical explanation connects back to those cervical drainage channels. In the left lateral position, The orientation of the neck and the angle of the cranial lymphatic outflow pathways aligns favorably with gravitational pull over the course of the night. In the right lateral position, that alignment is reversed. In the prone position, the cervical extension and rotation required to keep the airway clear compresses those channels almost entirely, reducing cerebrospinal fluid outflow to its lowest possible rate. Over 20 years of clinical practice, I have sat with patients who came to me with early cognitive complaints and no structural disease on imaging. The pattern I noticed was not their age. It was not their family history alone. In a striking and consistent number of cases, it was their sleep position. And right then, the picture clicked into place for me. Stomach sleeping delivers a third mechanism that most people never consider. When you lie face down, the lumbar spine, which is the lower section of the vertebral column in your back, enters a prolonged extension curve. The intervertebral discs, which are the cartilage cushions between each vertebra that absorb shock and allow movement, are placed under asymmetric sustained compression. After 50, disc hydration naturally decreases as the nucleus pulposus, which is the gel-like core of each disc, loses water content with age. A disc that is already less resilient and less hydrated than it was at 30 does not recover from 8 hours of extension loading the way it did at 25. The diaphragm, which is the dome-shaped primary breathing muscle that sits beneath the lungs, is also restricted in its anterior expansion during prone sleep, reducing the volume of each breath during the hours when cardiovascular restoration depends most on steady oxygenation. Less oxygen per breath across 8 hours is not a rounding error. It is a cumulative respiratory deficit delivered to a heart already working against displaced anatomy. I want to tell you about one of my patients. I will call her Mirella, 61 years old, retired school administrator. Not someone who complains easily, only comes to see a doctor when she is past the point of managing. And she was past that point. She came in reporting memory lapses that had been growing for about 2 years. She would lose words mid-conversation in a way that frightened her. Not occasionally, not once a week, but several times a day. She would walk into a room and stand there, unable to reconstruct why she had come. Her primary care physician had run a full panel of labs. Everything was normal. She had been told she was doing well for her age and that mild forgetfulness was expected. Mirella was not reassured. She was frightened. The first question I asked her was not about her diet or her supplements or her stress levels. I asked her, "Show me how you sleep. Physically show me what your body does when you lie down at night." She shifted in the exam chair and demonstrated. Stomach down, head rotated hard to the right arm tucked under her torso. She had slept that way since her 20s. "Mirella," I said, "your brain's drainage system has been working at a fraction of its designed capacity for years, and we can change that tonight." She looked at me the way patients look when they expected a new prescription and received something entirely different instead. "My sleep position is why I am losing words?" I told her it was not the only variable, but it was the one that required no specialist, no procedure, and no cost beyond a firm pillow. We referred her for neurological evaluation regardless, and the imaging confirmed no structural pathology. What it showed was a pattern in the cerebrospinal fluid dynamics consistent with reduced glymphatic throughput. The neurologist's recommendation mirrored mine exactly. The system was intact. It had simply been running obstructed for years. Mirella was not deteriorating. She was sleeping in the wrong direction. Write this down. Somewhere you will see it. There are 3 habits almost every person over 50 is carrying into their evenings that are compounding every mechanism I just described, and 2 of them are things most people consider harmless. The first is eating within 90 minutes to 2 hours of lying down. Not a heavy meal, the crackers at 9:30, the small bowl of cereal, the glass of juice you take with your evening medication. Any caloric intake within that window elevates gastric acid production and increases pressure on the lower esophageal sphincter at exactly the moment you are about to place your body in a horizontal position for the next 8 hours. If you are already sleeping on your right side or your stomach, you have created a 2-part mechanism that guarantees nighttime acid exposure to the esophageal lining. And nighttime reflux disrupts deep sleep. And disrupted deep sleep means a glymphatic system that never reaches the sustained slow-wave phase it requires to clear amyloid beta at meaningful rates. The second habit is alcohol within 3 hours of sleep. I know this is the part of the conversation that is unwelcome. Even one standard drink within that window suppresses slow-wave sleep, which is the deepest stage of non-REM sleep and the primary operating window of the glymphatic system. This has been replicated consistently across sleep research from Harvard Medical School and institutions across Europe. A glass of wine may feel like it eases you into sleep. Biochemically, it is selectively removing the most restorative hours of your night. The third habit is blue light screen exposure in the final hour before bed. Screens emit light in the wavelength range that suppresses melatonin production from the pineal gland, which is the small endocrine gland near the center of the brain that governs sleep-wake regulation. Delayed melatonin means delayed sleep onset and shorter duration of slow-wave sleep. 30 fewer minutes of deep sleep per night across a decade is not a minor inconvenience. It is a measurable accumulation of exactly the protein that Morella's neurologist found reflected in her cerebrospinal fluid patterns. Now, here is the most important thing I want you to hear right now, because the mechanism means nothing if you do not know how to change it. And most people who try to change their sleep position fail within the first week for a very specific reason I am going to help you avoid. I call this the left shift protocol. It has 3 parts, and you can begin tonight. The reason chronic right side and stomach sleepers abandon the transition is not lack of motivation. It is passive mechanics. Your body has conditioned its pressure points, shoulder alignment, and hip rotation to one position over decades. Changing that through willpower alone means waking up 3 times a night having rolled back, shoulder aching, and giving up by day 5. The protocol addresses the mechanics, not the motivation. Part 1 is the anchor pillow. Before you lie down tonight, place a firm, standard-sized sleeping pillow directly behind your lower back and buttocks while lying on your left side. This is a physical barrier, not a comfort prop. When your body begins its unconscious passive roll backward during sleep, the pillow intercepts the movement before it completes. You do not need to wake up. You do not need to correct yourself consciously. The pillow does the structural work. Within 2 to 3 weeks, your body will have established new proprioceptive habits, meaning new positional awareness in the muscles and joints, and the anchor pillow becomes less necessary. But for the first 3 weeks, it is not optional. Part 2 is the shoulder release. The single most common reason people quit left-side sleeping in the first few days is left shoulder compression. When you lie on your left side without adjustment, your body weight closes the shoulder joint against the mattress and creates an impingement sensation within 45 to 60 minutes. The solution is a slight forward lean of no more than 10 to 15 degrees. Place your right arm across the front of your body, resting on a pillow positioned in front of your chest. Let your left arm extend forward on the mattress at roughly the level of your chin, not folded underneath. This distributes your torso weight forward and removes the compressive load from the left shoulder entirely. This is the same position recommended by orthopedic sleep specialists following rotator cuff procedures because it eliminates joint impingement pressure mechanically rather than through padding. Part 3 is the bed frame elevation. Take a folded towel, 2 or 3 layers thick, or a small paperback book of similar thickness, and place it under the 2 legs of your bed frame at the head of the bed. This raises the head of the bag by 3 to 4 inches. This is a whole body incline. It is not the same as raising your pillow, which creates a cervical flexion that actually compresses the very lymphatic drainage channels in the neck you're trying to open. A whole body incline works with gravity over the entire length of the night. Research from clinical gastroenterology studies has shown this specific incline reduces nighttime reflux events by approximately 40%. It also assists passive cranial lymphatic drainage by maintaining a gravitationally favorable angle between the brain and the cervical lymph nodes throughout the night, during the hours when the glymphatic system is actively clearing waste. Marilla followed only those 3 changes: left side, anchor pillow, 4-inch bed elevation. She eliminated food within 90 minutes of sleep and turned her phone off an hour before lying down. 1 week later, she came back and said quietly, almost not believing herself, "I woke up twice, but I remembered where I was immediately both times, and I remembered my dream." After 1 month, she told me the word-finding lapses had reduced by more than half. After 3 months, she brought me a card. It said she felt like herself again. How old are you? Write it in the comments right now. I want to see which age group makes up the majority of our viewers, because it will directly shape what I cover in future videos. Here is exactly what to do after watching this. Step 1. Place a firm anchor pillow behind your lower back tonight before you lie down on your left side. Step 2. Position your right arm forward on a pillow in front of your chest to release the left shoulder. Step 3. Slide a folded towel under the head-side legs of your bed frame to create a 3 to 4 inch whole body incline. Step 4. Eliminate all food and alcohol within 90 minutes of your intended sleep time. Step 5. Begin dimming screens and overhead lighting 30 minutes before bed to allow melatonin production to begin on its natural schedule. Your doctor is not going to walk you through this at your next appointment. There is no revenue in it, and there is no time on a 12-minute office visit to explain the glymphatic system, cervical lymphatic drainage angles, left ventricular displacement during right-side sleep, and how your sleep position has been working against your body's nightly restoration cycle for decades. I am Dr. Candace Miller, and I have spent over 20 years watching what happens when people hand their health over to a system that profits from their confusion, not their clarity. Most of the time, the damage was entirely preventable. The protocol I just described requires no prescription, no procedure, and no money beyond the cost of a firm pillow. It requires only the understanding of how your body actually works and the discipline to use that knowledge. Subscribe to Dr. Candace, hit the like button, and help us reach 100,000 subscribers. Every person who subscribes makes it more likely that the next person who needs this information actually finds it. This video is for educational purposes only and does not constitute medical advice. Always consult a qualified healthcare provider before making changes to your health routine.